For people who are not in your clinical group, just make sure you get like your contact information so you can figure out how you're going to communicate and complete this little assignment over the next couple weeks. So if we look at your instructions here, you're going to use EHR Tutor, like I said, and that's in your ATI resources. You're going to find your patient. You're going to review the assigned chart and documentation. And then you're going to come up with nursing diagnoses, which are patient problems, right? So you're going to look at the data and say, well, it's clear this patient has impaired tissue integrity, or it's clear this patient has infection or impaired mobility, okay? And throughout each group, we'll cover all of the main topics that we've gone over from the beginning of the semester to the end. So it also is a helpful review as we get closer to the end of the semester and the final. Okay, so this first part, you're going to do this on your own. So you'll review all that documentation, you'll come up with the nursing diagnoses. As we go through this PowerPoint that you have in front of you, you'll see that there's a specific number that you'll end up with in the end, but at first, come up with as many as you think the patient has. Okay, and you want to make sure that it's complete, so if it's an actual nursing diagnosis, it'll have the related to part, which is the cause, right? And then the as evidenced by part are all of that abnormal data that you identified that helped you come up with that problem. Okay, so you'll turn that in to this assignment by Monday at 4. Okay, so between now and then you'll look through the chart. You can use this PowerPoint to take some notes on, keep track of your ideas, and then each of you individually will turn that in by Monday. Okay, so you'll just identify the problems. And then I'll look at it between Monday, the end of the day Monday, and Tuesday. And then in class on Tuesday, we're going to finish going through this PowerPoint, have a couple more activities related to wounds and skincare. And then you'll have a little bit of time to talk together and kind of compare notes and make sure you're on the same page. And then you can move forward together with the rest of the activity. Okay, so at first it's just the problems, and then from there, you're going to write out the goals as well as the interventions. This is just saying again, Tuesday we'll have some time for that. You may as well start doing it in your template so that you're ready to go for the following week. Okay, so this final PowerPoint filled in is turned in by everyone. I need to change this. It says one person. I'll update that. So everyone by the 24th then. And then if you look, there it's 2 assignments, right? So 2 down here. Okay, so it'll pop up on your calendar. Go back to this for now. Okay. All right, so that's due the 25th, and then we'll pull up your calendar just so you can see all these days. Then that last week in class, we're going to put that care plan into action as a group. You're going to care for the patient in the lab during class time on Wednesday. Okay, then afterwards, the second half of class, that'll just be like a 20-minute maybe little simulation that we'll do. Everybody will be assigned a role. Yeah.
Does each individual person in the group do one diagnosis and a care plan for
No,
that?
everybody does all of it. Yeah,
Or
everybody does all of it. Yeah.
As many as you can come up with?
Yeah. Where was it? Yeah, so about 20 minutes it'll take. We'll go through the simulation. You'll have your roles assigned that morning. One of you will be the patient. You'll have clear roles, so like somebody will do vitals, somebody will do head-to-toe assessment, somebody will give medication, so you'll have specific roles. You won't know what they are until you get there, but just know that that's what the roles will be. Like you'll do an assessment, vitals, just take care of your patient. So just be ready to be any of those things. So we'll go through about 20 minutes, go through it. And then, so we use both the labs. There's different instructors there to like observe and like as a resource if you have questions or need help. Okay, so we'll run through it. Then we'll come back in here, and then as a group, you'll take turns coming down here, and you'll pull up your PowerPoint, and you guys will go through and present it. So it's up to you how you want to divide it. Usually groups divide it by slides. You each take a couple slides and take turns speaking. Okay, so then you'll present your problems, your nursing diagnosis, the goals, and the plan. Okay, so that you can come up with a plan for your patient. Okay, so then at the end of that, we'll have gone through like pretty much all the content that you cover in this course for each part of what you turn in for the first part. You can just type in, these are the problems, turn it in, that's fine. Okay, but for the second part, that's due the 24th, this is what you will turn in. Okay, so you'll download this template, and then you'll start to edit it, and you'll change it based on your patient. Okay, so this slide is your patient's name, and then you'll have all the students in your group below that. Okay, the next slide is an explanation of what's going on with it. So you'll go through your data, but before you present that, you'll just give like a little summary. Like, my patient's from home, he has heart failure, he wasn't taking his medicines, he was short of breath, he came into the hospital, just like a little summary, introducing everyone to your patient. Okay, the next slide, you're gonna have all the abnormal data. So vitals, head to toe, lab work, anything that's abnormal in the chart that you find, you'll have on this slide. Okay, now at this point, during your presentation, you'll take a minute to pause, and then the rest of the class will try to say, based on this data, and just a little bit that I know, do any nursing diagnosis come to mind? Can I critically think and kind of come up with any of these? Because they're gonna be all familiar ones that we've been talking about. Okay, so then we'll go to this slide, and you'll give the class a chance to kind of think and volunteer and see if they can identify any. And then you're gonna go into the first nursing diagnosis. So after your first turn in, I'll give you the feedback. I'll say, this is number one. Hopefully it's one of the ones you had in your list. Okay, I'll say, this is number one. It needs to be your number one, so you'll know. Okay, so it'll be an actual problem related to whatever the cause is, as identified by the specific abnormal data that was pulled from that first slide with everything, but what just is for this nursing diagnosis. Okay, so your first main nursing diagnosis, your main goal for that one problem. Okay, so as you all work on this on your own, you should all have some variation of the same type of goal for this problem, because I'll give you all the same feedback. I'll say, this is number one, this is number two, whatever. Okay, so as you come together and talk about this, you should already kind of have an idea. You just want to kind of double check on the wording and make sure it makes sense. Okay, and then what are the interventions specifically for that problem to get that patient to the goal? Okay, and then all this data you're pulling from your patient's chart and then from that website with nursing diagnosis. So it has, what are the possible as evidenced by, what are the possible related to, what are the examples of goals, what are the nursing interventions. Okay, so all you have to do is read it, make it make sense for your patient, and then put it here specifically to your patient. Okay, after that then, what assessment data specifically are you gonna reassess in the evaluation phase to see if they're improving? Okay, and then we go to the next one. So I'll tell you from your list, what's the second priority? Again, it's an actual problem. What's the cause, and then what's the specific data for this problem? You'll come up with the goal. You'll come up with the intervention, the data that you'll reassess to make sure that your patient met those goals and they're improving. Okay, a third one. Okay, so from your list, same thing. I'll tell you what's your third focus. Problem, cause, data, what's the goal, what are the interventions, what's the reassessment I'm gonna focus on. Okay, and then your fourth and last one is a risk for diagnosis. Okay, so we'll identify at least 3 primary, like actual diagnoses that they have, like fluid deficit or impaired mobility or pain or impaired comfort, whatever it might be. And then I'll tell you to focus on a risk for, so risk for falls or risk for bleeding, risk for pressure injury, whatever it might be. Okay, so that would just be the problem, and then the cause why it could be a potential problem. And then this is just a reminder, there's no as evidenced by, because it's not an actual problem, it's just a potential problem. All right, so for this you have a goal, and then it's just reminding you, it should be that for whatever the risk for problem is, does not occur. Okay, what interventions are gonna prevent that problem from occurring? What assessment data will I reassess? And that's it. Okay, so 4 nursing diagnoses in all. So that's your PowerPoint. Okay, so but you'll see, so that first part then, you'll come up with nursing diagnosis that you can identify. And then you'll upload it. It's due Monday at 4. Okay? And then Tuesday in class, you'll have a little bit of time to talk to your group, asking if you have any questions. then the whole rest of it will be due, and then we'll have some simulation, and then we'll have our presentation. All right, any questions off the bat about this? We've been doing it for a few years now. It's lots of fun. It's a lot of work, but at the end, you kind of feel very accomplished, and you feel better about having a big picture about what you just went through this first semester and what it's like to be a nurse and kind of put all those pieces together and in action. The next thing we're going to do is talk about tissue integrity, but first we're going to go back to that crossword puzzle. So your crossword puzzle from last week, if you have that, you want to pull that out. Is anyone having trouble with the internet today? It's during class. It's during class. All right. All right, if yours is still kind of blank while I was getting this to work, start filling it in. All right, here's your crossword in front of you. So we'll just take turns here going through the row. So the first one down, so this is all vocabulary. So a lot of tissue integrity is going to be vocabulary. So depending on your background and where you're at in your classes, a lot of this is all repetitive, or maybe, or maybe depending on where you're at, some of it's new. Okay, but it's basic A and P as far as the integumentary system. So we'll start with Allie, since you're in the front here. So what's the term for pale red or pink watery mixture of serum and blood? Okay, one down. What do you think? It's a long one, and it's actually two words. One down here. Pale red or pink watery mixture of serum and blood. What do you think? Any ideas? No clue? All right, anybody want to help her? Anyone help Allie? Emily?
Sarah's sanguineous tissue.
It's serosanguinous exudate, is it? Okay, so we're talking about, so there's 4 different terms for types of exudate that you read about that you need to know, and one of them was serosanguinous, and it's pale red or pink watery. Okay, so not straight blood, not just like serum that you see in a blister if your shoes are too tight. Okay, it's kind of in between. Serosanguinous is pale, clear, watery. Okay, and that second word is exudate, E-X-U-D-A-T. Okay?
Can you repeat that? The second word?
Serosanguinous, it's in your reading, I'm sure you can find it. Yep, if you go into ATI and use your search bar, yep, it's in your PowerPoint, it's all over the place. Okay, number 2, what do you think, Bree? Term for new tissue that fills a wound during healing.
Granulation.
It is granulation, good, okay, good. New tissue that fills is granulation tissue, good, that was 2 down, granulation tissue. Okay, so as we're doing wound care, that's what we're looking for. We hope to see that means that that wound is healing and new tissue is growing. All right, 3 down. What do we think, Joey? Softening and breakdown of skin from prolonged moisture and exposure. Yeah, that was maceration. Okay, maceration. Okay, M-A-C, maceration. Okay, so softening and breakdown. Good. All right, Riley, what did you get? Medical term for a bed sore. Yep, that's a pressure ulcer. Okay, we used to call them bed sores, pressure sore, you might see pressure ulcer is the most recent term. Okay, ulcer, it's an opening in the skin.
So it's ulcer, not injury.
Whatever fits.
Well, I couldn't read the numbers on
Let
mine,
me
on the front.
ulcer. Riley, Jennifer, what'd you get for an area of dead tissue caused by a lack of blood flow? Oh, ischemic?
There we go.
Area of dead tissue caused by lack of blood flow. Did anybody get anything else on that one?
Necrosis.
Yeah, necrosis or necrotic. Yeah, area of dead tissue is necrotic. Necrotic tissue. Okay, good. Ischemia or ischemic tissue is on its way to dying. So ischemia is the condition where they don't have good perfusion. Ischemic is tissue that has been not being perfused, and then from prolonged lack of perfusion, it will become necrotic. All right, Taylor, the final phase of wound healing, collagen is reorganized and the wound strengthens and closes fully. Yeah, that's the remodeling phase, yep. So there's 3 phases of wound healing. That final one that you want to know is the remodeling phase. It doesn't fit?
No, because I tried maturation and remodeling in that, and it, neither one of them.
Let's see. Remodel phase. It said it is.
Well, I just said remodeling, I didn't say fix.
Oh, okay.
So,
That's why.
All right, and then Dawn, soft, moist, devitalized tissue, yellow, tan, or white, often seen in wounds. Yeah, it's slough, okay? And so as we're assessing, we want to see granulation tissue, that's good. We don't want to see slough, that's dead, bacterialized tissue. We will need to get that out of there. All right, moving across then, we're at Ian, reduced blood flow to tissues causing oxygen deprivation and potential tissue damage.
I don't have mine on me right now, but.
Anybody want to help them with 5 across? Alexis? Yeah, that one's ischemia. Okay, so reduced blood flow to tissues is ischemia. That's like a condition that's occurred. All right, and then we're up to Logan. What do you think about partial or total separation of wound layers after closure?
Wound.
It's dehiscence. Yeah, dehiscence. Okay, so when we're looking at a wound that's been sutured, we want it to be approximated, which means it's all together. loss, and scarring.
Primary or first intention healing?
Okay, good. The wound edges are directly closed with minimal tissue loss. So in addition to the phases of healing, there's also different types of healing. There's primary, secondary, or tertiary. And then this one where the wound edges are directly closed, that's gonna be minimal, or I'm sorry, primary. All right, Emily, you've done enough, I say. Let's go up to Ally. Thick yellow, green, or brown drainage containing pus indicates infection. What'd you get for that, Ally? Sure. That-
Is it purulent?
Yeah, that's purulent, okay, so we've said serosanguinous, and then now we've identified purulent, okay, as one of the 4 types from your reading.
So in the crossword, then is it exudate after it?
I'll pull up the answer key.
Okay.
All right, and then, so Deb did that, and then Erin, what'd you get for the outer protective layer of skin? Outer protective layer of skin, anyone have a different guess? She said dermis. Yeah, it's the epidermis, okay, epidermis, then dermis, okay, epidermis, then dermis, then subcutaneous, right? Jacob, what'd you get for 12? A disruption in the normal continuity of the skin or mucous membrane. What's it? Just a generic. Yeah, it's just a wound. Yeah, good. Wound. Okay, and then Mitchell, 13, removal of dead, damaged, or infected tissue to promote healing.
I thought it was irrigation, but I don't think that's.
You don't think that is now? James, guesses? Kennedy? It's debridement. Yeah, debridement. James or Kennedy, did you get 15? Granulation tissue forms and the wound begins to fill and contract. Alexis? Yeah, that's the second phase, so the proliferative phase or the proliferation phase. So that comes before the remodeling phase. Okay, so that wound is filling in. Okay, and then the last one, characterized by redness, swelling, heat, and pain as white blood cells remove debris and fight infection. Anybody get that one? Yeah, and so that's the first phase, the inflammatory phase. Okay, so you've read and learned about 3 phases of healing. Inflammatory phase was the first one. All right, so hopefully that was a good little intro. Start getting your vocab. This is pretty small. Let's see if I can. All right, so if you weren't clear on some of those terms or how to fit all that in, was serosanguinous exudate, proliferative phase, inflammatory phase, purulent exudate, primary intention. Pressure ulcer. All right. Next, let's go ahead and look at your first handout, the nursing process. So going through ADPI for tissue integrity. Let's go through our ADPI here. We'll just have you guys read these sections. So how about Kennedy, why don't you start and read our patient profile.
Name, Mrs. Linda Smith, age 68 years, gender female, admitted diagnosis was offered as total hip replacement of the right hip, past medical history, type 2 diabetes, peripheral vascular disease, arthritis, no known allergies, medications, metformin,
Atorvastatin.
ibuprofen, activity order
right, good. So we've got some background info. Who's next there? Ava, you want to read our scenario?
On post-operative day 2, Mrs. Smith reports mild pain at the incision site and recognize other discomfort. While assisting with the bed bath, removal soreness on the sacral area and a small open area, 0.5 centimeters, on the right buttock with serous drainage. The skin around the area appears dry and fragile.
Okay. Good. Move this up, and then you want to read our assessment data.
So subjective data, patient states on volatile score, and I'm lighting on my back too long, before sitting up most of the day, and then because it's more comfortable for the hips. I'm gonna read the objective. Objective data, weakness in small open area on buttocks, limited mobility due to surgery, skin drawing and want to touch after refills in lower extremity. 3 seconds, Brady's scale score is a 15 minor risk, or glucose 172 milligrams.
Alright. Alright, so that's our data there that we've collected on our patients. So they're telling us that they have some pain. They're giving us some information about their activity, some background info, and then the information that we can see. So skin is supposed to be intact, right? It's supposed to be normal color for ethnicity, but there's some redness, and then there's also some open areas. She's not moving like she should because she had surgery. Her skin is dry, it is warm. Cap refill is greater than 3, which is our cutoff, right? So that's abnormal. Braden of 15, which we're just gonna start talking about those numbers, but it tells you next to it that she's a moderate risk. And the Braden scale is an assessment that assesses their risk for pressure sores, right? So we've worked on it a little bit in clinical. You're supposed to fill it out every week. We touched on it in head to toe assessment, but then we'll really go through it specifically with tissue integrity. Okay, and then their blood glucose is 172. So do we know yet, have we figured out why uncontrolled blood sugar, so 172, that's too high, right? It's looking around 100. So why is that linked in here with wound care and healing? Anybody pick up on that? How high blood sugar affects our healing? Yeah, it slows it down. Okay, so we're not just worried that your blood sugar's high and we have to give you insulin, but it delays wound healing. So you read about acute versus chronic wounds. So some diabetic patients who are uncontrolled, those are the ones who are gonna have those not healing chronic wounds that never heal. You don't have patients who have wounds that will never heal. If we can't get that blood sugar under control, and we can't get them nutrition to their cells for that granulation tissue to happen, then they're always gonna happen. Alright, let's go to Haley, our nursing diagnoses that we've identified then.
Primary nursing diagnosis, impaired tissue integrity related to pressure and increased mobility, as evidenced by open area on buttocks and redness on sacrum. Secondary diagnosis, optional teaching, risk for infection related to open skin area, knowledge to patient and family related to skin care and incision.
Okay, so our primary nursing diagnosis is impaired tissue integrity. You might also see some places impaired skin integrity. They're kind of used interchangeable, and as long as it's just like the top layers of skin that are missing, then impaired skin integrity still applies. But once you get below the layers of skin and you're into the fat and the subcutaneous, it's impaired tissue. So that's more often what we're gonna see because it covers everything. So that's the nursing diagnosis, or the problem is they have impaired tissue integrity. The cause, so why do they have this openness, is because of pressure. So like laying in one spot and that pressure on the tissue is not getting a relief, there is ischemia happening, and then decreased mobility. So those are the main causes. And then how do you know? What's the signs or symptoms that led you to identify impaired tissue integrity? Is just open area on buttock and then redness on sacrum, okay? And then the secondary diagnoses, it's not on here, but this patient also has a risk for impaired tissue integrity, right? So they have an actual, but they have a continued risk for more ones to develop, so you kind of be on the lookout for that. And then one that we're always going to piggyback on impaired tissue integrity is risk for infection. So we've talked about it all along, and we'll talk about it with our immunity lecture, is that skin is our first line of defense. And so once our skin is broken or open, we're at a high risk for infection invading our body. Okay, so then the why they're at a high risk is because they have that open area. Okay, and then knowledge deficit is a nursing diagnosis or problem that you can attach to any patient problem. Next semester specifically, you'll have like a whole lecture on patient teaching and all the steps that you follow and how you document and all those things. But knowledge deficit, related to medication or activity or whatever it might be. And then, so the reason for this one, it would be about skincare and repositioning. Okay, so they didn't know that even though she was on bed rest and just had surgery, even in that short time, she can develop these ulcers, so we would need to educate them on that. So even if she can't get up, we turn them, right? Every 2 hours, we can get them like special mattresses, make sure they have nutritional supplements if that's something that they need. All right, who's next? Hannah, you wanna read our planning and goals, and we've got some short term, and then we've also got some long term.
Short-term goals within 48 hours. The open area will show no increase in size or drainage. The patient will provide understanding of the need to change positions in 2 hours. Long-term goals within 1 week. The pressure area will begin to heal with evidence of granulation tissue. The patient and family will demonstrate proper skincare techniques to prevent further breakdown.
Okay, so at first, we just don't want it to get worse, right? We've found it now, we've identified it, we're gonna do some care to it, we just don't want it to get worse. And then we want them to understand what's going on now. And then long term, not only do we not want it to get worse, but we want it to heal. We want it to fill in and close up, okay? And then that the family will understand proper skincare to prevent any problems in the future. All right, and then how are we gonna get them there? So what are the things that we're gonna do, the nursing interventions? And then this time on this paper, you see that we've got the rationale next to it. So we've talked about rationale a little bit off and on. As you're learning all of your skills in lab, there's always like the step of the skill and then off to the side, the rationale. And learning how to do a skill and remembering how to do it is a lot easier if you understand the rationale, because you're not just memorizing step by step and freaking out if you're gonna miss a step. You're actually understanding what you're doing and you're understanding how to do it, so that thrown in any scenario, you kind of are going to assess the situation, see what supplies you have, but you know the basic steps to do it. So anytime there's a rationale, you really want to focus on that and understand why. So who feels like reading a lot? Olivia, you do. So nursing intervention, you can just do the end of the first page. Do nursing intervention, and then when you say the nursing intervention, say the rationale that goes with it.
Reposition the patient at least every 2 hours, alternating between back and side. This will reduce pressure on the sacrum and buttocks to promote circulation and healing. Keep the affected area clean and dry. Cleanse gently with mild soap and water to prevent infection and further tissue breakdown. Apply a moisture barrier cream to the sacral area to protect the skin from moisture and friction.
these are all nursing interventions that if you identify that this is a problem or a potential problem for your patient, this would be part of your plan of care. As you go in and do your rounding and you get your vitals and you do your assessment, you're focusing on all these things during your time in there. So it kind of reflects on that ischemia and necrosis talk that we had there about promoting circulation and healing, touches on nutrition. So everything all goes together, making sure they get the protein and vitamins and zinc so that their tissues can repair and that they don't have to develop an infection. Okay, and then there's obviously going to be some collaboration with some other professionals if there's like mattresses or equipment that your patient needs that you don't have. And then all of our facilities also have a wound care nurse as well that come around and assess our patients and recommend or assist with wound care. All right, and then Nash, you want to read our evaluation phase?
Desired outcome, so if an area of the buttock remains clean, dry, shows no increase in size, patient and family demonstrate repositioning every 2 hours with minimal assistance. Patient's grade scale score improves from 15 to 18 and it can be low risk. Skin around the sacral area remains intact with no redness or breakdown. Goals are not met. Recess contributing factors, e.g. moisture, nutrition, mobility. Consult wound care specialist for additional interventions and modify care plan accordingly.
Very good. Any questions on this initial vocab that we've gone through and the nursing process with tissue integrity? All right, now's a good time to go ahead and take a break. So when we come back, you'll work with your group and you're gonna do that case study. So the next handout, there's a little scenario and then there's questions. So you can take a break or you can start that now and then take a break, whatever you wanna do. But we'll have 10-minute break, about 10-15 minutes to work on that, and then we'll share what you guys come up with.